For this next session of the America's Long-Term Care Crisis Reporting Fellowship, we're going to hear about some of the threads that we've been discussing all through the rest of the day, and that would be the need for policy support and caregiver training for families. When you received your reading list for this fellowship, one of the stories that was included was written by our first speaker today, columnist for the Wall Street Journal, Clare Ansberry. It was about one family's outrageous experience of spending $1 million on care for the mother after the father in the family had passed. But Clare has a long record of writing about these kinds of issues, healthcare for families and supports that they need. Clare will be joined later by Debbie Witchey, who is the Executive Vice President and COO of the Healthcare Leadership Council. But in short, this session is designed to help give you some really important contextual insights about those two issues, policy and training, and how we support families. So I'll let Clare start us off and take it away. Thank you for joining us.
Thank you for the opportunity to be here. You have a great lineup of experts and authorities at this fellowship. I, on the other hand, am a journalist like you. And as such, Rachel suggested I talk about some stories, their genesis, and the process. So basically, that's what I'm going to do, and hopefully it will be helpful. But first, some background. I'm guessing I've been a journalist for much longer than any of you, and I started my career at a mid-sized daily in Lorain, Ohio, as a general assignment reporter. So I was covering everything from unnecessary long school board meetings, council meetings, and profiles. But I remember one series that we did at that paper, and it was a relatively small paper, and it was years ago, and it was called Coming of Age. And it was about growing older and what that looked like in a depressed steel mill community. It was about isolation and quality of care, and things like adult daycare programs were emerging. So fast forward a few decades, and some of the same issues are being discussed, but with more urgency due to the rapidly aging population. I'm not a beat reporter, and I don't cover an industry like long-term care, insurance, or any public policy. I used to cover steel and manufacturing, and then managed reporters doing the same thing. But I always tried to keep my hand in writing and in reporting, and I seem to gravitate towards stories about people and their families and their relationships and aging. So I've written a lot about the impact of aging population on family caregivers, because I've seen how they really are the backbone of the nation's long-term care system. And I've also seen how it's worked in my own family and in my extended family. So we all know as journalists that readers and viewers and listeners have so much coming at them, and they can pick and choose and ignore anything and everything we want to write about or publish. So in every story, I think we all have to answer, why are we writing about this, and why now? What does this mean in the broader context beyond a few of the individuals' lives that I might find interesting? So I would spend a lot of time looking for people whose situations, their backgrounds, their frustrations, their worries are relatable and compelling. Okay. This first story appeared in 2018, and frankly, it's just change the figures and the data and update them, and it's a lot of the situations are the same. It was on how the nation is running out of caregivers just when we need them most. And I had originally proposed a series of stories on family caregivers and those who need care in different situations. Like I wanted to do a piece on long-distance caregivers, people who don't have any family. But we also had a coming retirement crisis package that was in the works. And so this subject had the potential to fit in, as long as I could show and explain why. So I looked at the data. I talked to dozens of researchers and experts, including people who spoke here today, to get a handle on sort of the big picture and the backdrop, to show what is happening right now and how that has changed. We always need a trend. Is it increasing or decreasing, and why? So basically looking at the demographic, the economic, the social, and the cultural factors at work, and also how it matters. And this is what I found. And some of these figures are updated again because this is 2018, but every day until 2030, 10,000 baby boomers will turn 65, and 7 out of 10 people will require long-term care in their lifetime. Now, the cultural and societal forces. Family caregivers are the ones who have always stepped in. They represent about 95% of the 48 million adults who are providing care to adults. But today, those family caregivers, those adult children, or relatives, nieces, nephews, aren't always around to help them, or they live far away, or they're juggling their own kids and 2 jobs. And families are smaller too. There aren't 5 kids to pitch in and to provide backup help. So they're stretched. There's also a growing number of older adults who never married and never had kids. They're the so-called elder orphans or solo agers. So what happens to them? 1/3 of middle-aged adults are heading toward retirement years as singles. And then there's the economic forces. I found that the private sector isn't always an option. I think you've heard a lot about that. There aren't enough private home health aides, and the situation was worse then, and it's just getting worse over time, in large part, because of the low pay. The median pay in 2021 was $14.15 an hour, or $29,000 a year for home health aide and personal care aides. And even with that low pay, it's really expensive for families who are just trying to care for a loved one. A year's worth of full-time, 40 hours a week, home health aides is close to $62,000, and that represented a 12.5% increase since 2020. And public support hasn't kept pace either. Medicare and other government programs provide a fraction of long-term supportive services that people need to remain in their own homes. Medicare doesn't generally pay for long-term care in nursing homes, which, if you've heard, is over $100,000 a year for private room. Most people, and I think this was discussed earlier, just really assume that Medicare and Medicaid will pay for things, and it's such a shock when they don't. So I did a lot of reporting to try to find the right people to tell this story. And it's basic reporting, calling around. I talked to a lot of people who ran volunteer programs serving the elderly, community agencies. I talked with friends. I talked with people who ran caregiver support programs. I read them, all the comments on Facebook. And I talked with people who worked at long-term care communities or agencies that provided in-home help. And these are the stories of the people I found. That's Clesta Dixon. She was in her 80s when I met her. She had never married. She was a retired teacher in a tidy apartment, and a so-called elder orphan or solo ager. She had 1 brother. He was 82, so she couldn't expect him to take care of her. So basically, she did not have what they call a natural caregiver. No one in her family. And she was not lamenting. She wasn't complaining. She was just very realistic. She made her funeral arrangements because she didn't have anyone else to do it. She was smart, she was independent, but she also knew that social networks were really important, and she also reached out for help, signing up at a nonprofit organization that provided volunteers to drive her places. And that organization is the one that connected me with her. And there was a really telling point in her story. She purchased long-term care insurance after she retired, so years and years before, probably 20 years. 20 years she had been paying into the system to provide long-term care, and she was really counting on that because she didn't have anybody else. It was a smart thing, and it was forward-looking. But then she had to drop the coverage because the premiums had really increased. So all of this that she had paid into wasn't going to help her. So at that point when I was talking with her, she was still on her own, but she was looking ahead at how she would be able to afford assisted living. And her goal of getting a single room was no longer feasible. And she was thinking, I'm going to have to live in a shared room, and I better start getting rid of my belongings because they just won't all fit. Another example that I wanted to get was the long-distance caregiver, because families are all over the place. So you have a daughter in California or Florida trying to take care of their mom in Ohio. And there was a daughter in Florida, and her mom was in Ohio, and her dad had dementia. And so she was worrying about care for him, but she was really worried about her mom because her mom was overwhelmed with the care. And so the daughter from Florida, she cobbled together a patchwork quilt of care. You know, she called her childhood friends. She called extended relatives and acquaintances. She called her mom all the time. She and her brother came up every few weeks. And in spite of that really diligent care and being, trying to be there, she wasn't there. And there was such tremendous guilt. And I think that's a situation that a lot of family caregivers find themselves in. They do so much. They give everything they can, and they feel like it's just not enough because they can't be there all the time, and the supports aren't there for their family. And I found her through AARP, one of your experts here, and just asking if they knew someone who was a long-distance caregiver who would be willing to talk to me. And I also wanted to show an example of a divorced older adult and what happens to them and why. And because between 1990 and 2010, the divorce rate among adults ages 50 and older doubled. So that means there's going to be fewer spouses available as caregivers. And I found a man who monitored care for his ex-wife who had dementia. And that sounds kind of strange, especially since they really had not kept in touch for years, for decades. So why would he step up? Why would this guy go and visit? And he gave two reasons. He said, I want to help my daughter, our daughter, who lived 1,000 miles away, and because he knew she couldn't be there, so he wanted to be there for her. And he also was in the same boat when he was younger. He lived out of state, and he relied on a neighbor to come in and check on them. So that also shows that things haven't changed all that much. So he wanted to return that favor. And he was very honest about what that situation of caring for his ex-wife kind of opened his eyes to. And it wasn't the thing about, there was an element of purpose in that he felt like he was helping his daughters, but it was shocking to him and frightening and heartbreaking. He said to look at his wife and in her situation and what was ahead for him and his own partner. So in reporting this story, I found that nonprofits and volunteer organizations often step in to fill the informal caregiving gap. And they were great, and they're stretched themselves, and they rely so much on the generosity of others and volunteers. And they were great resources for getting me in touch with older adults like Clesta and another woman who lived in Latrobe, which happens to be Fred Rogers' neighborhood. And so I thought that would be like a perfect place to try to situate a neighbor caring for someone else, because that's an important part of informal caregiving. And I found a woman who, like so many older adults, just desperately wants to remain in her home on her own, but she can't on her own because she doesn't drive. Her two daughters live out of state. So there was a volunteer with a local organization who drove her where she needed to the doctor's appointments and hair appointments, and they formed a very special and close bond. And again, that's an important part of the whole caregiving situation, is finding some bonding with people, neighbors and friends. And the older woman was being released from the hospital after surgery, and the hospital said, well, you're going to have to go to a nursing facility unless there's somebody to stay with you. And her kids weren't around, so this volunteer offered to spend the night and just stay with this woman until she was on her own. That's a tenuous situation. She happened to find somebody who would help her, and someone that they they bound together with. So hopefully, this story just kind of showed what the future may hold for all of us who aren't currently family caregivers, and it also has a big impact on the public and private programs that we expect to support. All right, so this is the story that Rachel mentioned about a family who spent $1 million to take care of their mother. I would like to say I found this family after a lot of searching and reporting, but I didn't. The son emailed me after reading one of my stories about, basically it was a guide about finding caregivers. And so it was real basic things about assessing costs and using agencies and contracts. And his email talked about his father, how his father, who had been a primary caregiver of their mom, who had Parkinson's, passed away, and how a neighbor who had been working part-time cleaning and just kind of helping their dad stepped up. She became a full-time and salaried caregiver and managed a crew of other workers over a decade. And he talked about how wonderful she was and what she did for them. And then he buried what I thought was the lead. In the third paragraph of his 3-paragraph note, he mentioned that they spent more than $1 million to take care of her at home. And it actually turned out to be more than that. So that number stopped me. I thought, geez, does anyone start a caregiving journey, a family member, really expecting to spend that much? Then after sort of an initial, oh my God, that's a ton of money, I realized that it's not surprising. And the fact that it wasn't surprising is kind of stunning in itself. Because in-home care is expensive, and their mother needed 24-hour care, and her needs stretched out over a decade. And that was the other thing. Families, including theirs, don't often expect their parents to last that long. Their dad had taken care of their mom when he died, they expected she would follow soon thereafter. And that doesn't always happen. This woman was 78 when her husband died and lived another decade longer. And people are living longer. Those 85 to 99 are among the fastest growing age segments, but they're also more frail and they need more assistance. The daughter said, "Never in my wildest dreams did I think she would last until she was 88. Now, this family was fortunate because their parents were savers, but not many are. It was really telling that only 1 in 5 adults between the ages of 50 and 80 are very confident that they'll be able to afford to pay for in-home help. And in this story, I needed the documentation to make sure the family really did spend that much. And so the son sent me his mother's tax statements for the decade, which showed the wages and bonuses and her own income, and then talked with the caregivers for verification. And one thing that, this family, they were fortunate to have this woman stay with them for a whole decade. But a big reason she stayed with them was because they paid very well. They put her on salary. This was in a small town. She made more than the average salary. They gave out Christmas bonuses of several thousand a year, gave out Christmas gifts. So people stuck around, and their home was a nice place to work. They treated people well. So that was, he was saying we paid for it, but we made it work. This next story is on inflation, and it appeared in 2022. Inflation was hitting every sector of the economy, and all reporters were looking at how it impacted the areas and the people we write about. Long-term care providers were raising rates and adding fees, citing, legitimately so, inflation, and added costs related to COVID in terms of safety and cleaning and the staff shortages. So everyone is affected by inflation, but the toll can be especially hard on people with fixed incomes who are medically fragile and leaving them with few alternatives to find less expensive options. Now, the lead example on this was a son who got in touch with me, and he had received a letter from the CEO of the memory care facility where his 92-year-old mother lived. and it alerted him that effective September 15th, 2022, and I think he got the letter in August, that there would be a new $25 a day special assessment fee for the rest of the year. So that unexpected fee was in addition to the 10% rate increase imposed at the beginning of the year, and rates were scheduled to rise another 11 to 12% at the beginning of 2023. And his mom is on fixed income, Social Security, and a small pension from her years at General Electric. So that amounted to $3,100. And she had long-term care insurance, but that coverage had run out. So her monthly bill was more than $9,700. Her savings covered the difference, but the savings were running out. And he was mad, and he was mad on not just on behalf of his mother, but on behalf of all the other residents at the facility where she lived, who were simply accepting the new fee because they and their family members felt they had no choice. He said the caregivers were wonderful, and he knew they deserved a raise, and so he didn't object to these annual 10% and 11% increases. But he was really upset by the new daily fee that it just kind of appeared. And he's saying, how many people, how many older adults can afford another $25 a day? So he sent me from letters, again on the verification, the letters announcing the increases, and so I had all the documentation I needed. But reporting this out, I found this really isn't isolated, that some nursing homes were charging for services that had been free, like the van to take people to the grocery store, or they were boosting so-called entrance fees or one-time charges to secure, just to get a place. And one family whose mother was, she was in a nice community and she had been there for a while, they had to go out and hire their own private caregiver to come into the facility to be with their mom and sit with her because she had been deemed a fall risk. So in 1 month, they spent $10,000 for that private caregiver, and that was on top of the $8,500 that they were paying that month for the assisted living room and that level of care. And the daughter said, this is a huge wake-up call for our generation. How in the heck are we going to afford future care costs? And there was a recent study concluded that by 2033, more than 11 million middle-income seniors age 75 and older might not be able to pay for assisted living. And this is the group, too, that is also not eligible and probably wouldn't qualify for Medicaid unless they spent everything down. This last story was also part of a package that looked at the lasting demographic, social, and economic impact of the COVID-19 pandemic. And I had been hearing and reading a lot about how the pandemic put older adults more at risk for abuse because they were isolated. And abuse affects not only them, but their family members who are their caregivers or are trying to oversee care. So I wanted to do a piece on that, and it just kind of fit into this package of stories because COVID had really changed things that had been present before the pandemic and are going to continue after. So I did a lot of research, FBI reports on internet crime and studies, and I found a really relevant study that found that more than 1 in 5 older people living in homes or apartments as opposed to facilities reported abuse in April and May 2020, when all the states had stay-at-home orders. And that was an 83.6% increase over pre-pandemic prevalence estimates. So there was isolation, people being left at home with their abusers because of the stay-at-home mandates. But there were also a lot more opportunities for scams and frauds because of all the online transactions. So again, I spent a lot of time talking to elder abuse task forces and prosecutors who had sort of special vulnerable adult investigation units and the National Centers on Elder Abuse. And they in turn pointed me to some cases that had been successfully prosecuted, which in turn led me to some examples in the story. One family's mother was robbed by the part-time worker who had a felony record, but was hired to fill a staff shortage because apparently nothing showed up on her background check, and even though the family found out easily enough. And they were understandably outraged and helpful in providing police reports. It was also really important to get a financial abuse example because that was the abuse that was really increasing so much, and the data was there. And the woman whose property was stolen by 3 people who forged her name in a virtual transaction, and again, that was super commonplace in the pandemic. And I knew Florida would be a good place to look because of the demographics and the valuable real estate market. I also wanted to get an example of physical abuse because as awful as it is, it's real, and it's often at the hands of family members, which nobody even wants to imagine. And it became even more common during the pandemic when people were stuck at home. And for this example, too, I found it from a woman who ran a coordinated response team for elder abuse reports. And I think the hardest part of this story, I talked to the daughter and tried to talk to the son who was charged with the abuse. I think the hardest part of this story was getting the father who had been abused to talk to me. He was a quiet man to begin with, and he was also really ashamed that the son that he raised had hit him. And that's why so much abuse by family members is undetected. I did get to talk to him. The daughter put him on the phone with me, and he basically said, just 1 or 2 lines. He says, "I was surprised and hurting on my leg and in my heart." So I've done a lot of other stories on long-term care and family caregivers, the siblings who fight, the 80-year-old caring for the 100-year-old mother. I mean, we just heard 10% of caregivers are 80 years and older. The people seeing 6 different caregivers in 6 weeks because of all the turnover. And there are hundreds of other stories to be done because family caregiving plays a huge and increasingly important role in our economy and our aging society. And I hope to see and read yours.
So have a caveat before I start, which is Rachel asked me to talk about some of the things that are being done to address and help in the family caregiving area. And that's what I'm going to talk about, but I don't want it to come across as I think all this is solved and this is the answer to everything. But I do think that there are certain motivations that exist to help to address and support family caregivers more, and also to try to get a better integrated system in healthcare. So before I start, I'm with the Healthcare Leadership Council. I'm not sure where to stand. I'll stand here in the middle, I guess. Our members are CEOs from all different sectors of healthcare. So we have for-profit and not-for-profit. We have medical device, pharma, hospitals, health plans. We do have a not home health, but aid, senior helpers that provides aids in the home is one of our members. So our member companies are a very self-selected group. We're limited to about 50 because they all want to know each other and have a relationship with each other and work on developing better sort of more looking to the long term and a better care delivery system. So they really need to develop a relationship and a trust with each other, because I think all of you probably know that in other settings, they're all used to fighting with each other, to be blunt. But at our table, as I said, they're a self-selected group, and they want to come together to try to work on better coordinated and integrated care. So there are 3 takeaways I have for today. Rachel asked me to talk about, sort of what are the myths or what are things that people might not realize. So my first myth is, or unknown information, is that the healthcare sector or the industry really is interested in supporting family caregivers. And you might think, well, they want to get paid to do that, so why would they want family caregivers to be helping? But quite honestly, there are a couple of reasons. Number one, there just aren't, and the healthcare workforce issue is something that everyone's writing about and talking about every day. There's just an incredible shortage. It's become worse with coming out of the pandemic with people quitting. And also, and it sounds like you all have been talking about this all day, we have just more and more people who are needing caregivers, and there just are not enough of them. So there's no way that the healthcare industry writ large can solve that problem, and so they really do need to rely on the family caregiver. Our members, and I would say increasingly more and more healthcare organizations, certainly not all or most even yet, but are starting to realize that value-based care, that more integrated care, coordinated care is probably a better way to go for the hospital systems that were already in value-based arrangements. They fared much better financially during the pandemic and came out of it more resilient than those that were still relying on the old fee-for-service system. So I think slowly more organizations are moving that way. Our membership has been interested in moving to value-based care for a long time, and part of that is because it better serves the high-need patient, the complex patient who has lots of transitions in and out of care, who is home and in the hospital or in rehab. Most of the problems that happen or the bad outcomes that happen because of poor transitions between all of those pieces. And if you're in an environment where it's coordinated better, then there's less chance of that happening. So value-based care is something that they're really interested in, and family caregivers play an important role in that piece because they're often that individual who is helping with those transitions, but they need training in order to do it right. They can mean that better outcomes happen, but they can also, if they don't know what they're doing, they can also, unintentionally, it can lead to harm for people. So just really quickly, when people have a family caregiver, we see better results. 30% are less likely to show up in the ER with a problem, 50% are less likely to end up in the hospital, and they have shorter hospital stays when they end up in the hospital. So family caregivers definitely improve the care delivery, and I've already talked about this whole issue with the chronic conditions and why that's important. And as I mentioned, the workforce shortage issue, there are going to be at least 1 million new aide positions that will become available, and these are the paid positions in the coming 10 years. The most vacancies of any field, not just healthcare, that's anticipated by the Labor Department is those home aides. And of aides in general, and then 25% of those will be in home health and the personal aides. So huge gap that really can't be filled by the healthcare industry. So the other thing I wanted to touch on for a minute, and my second takeaway, is that employers are increasingly interested in family caregiving and the burden that is on their employees who are family caregivers. I definitely think if you work for a big company, as is often the case with benefits, there are more established benefits available for family caregivers, but I would also say that I think a lot of the smaller companies are probably giving flexibilities to employees. It's just, if they were surveyed and asked, do you offer elder care benefits, they would say no. But I think about my husband, who owns a small business, and again, if you asked him, he would say he does not offer services, but I know for a fact that he has several employees who are dealing with elderly parents, and he's constantly rearranging work schedules, working out other flexible arrangements for them, and sometimes asking me to help them to find services for their family members. So the Bureau of Labor Statistics says that their numbers actually, I think 24% of individuals are serving as a caregiver, either for a family member or a friend. And this kind of caregiving is really averaging more than 20 hours per week. It might not be the direct caregiving, and you all may have talked about this earlier today, but it's also just the navigation and having to make phone calls and make appointments and figure out care and that sort of thing. I thought this was really interesting, and I was surprised by it, that 25% are millennials. I thought it was more my age range, caring for parents. But and of course, we've heard from Claire. I mean, this is just a drop in the bucket, but the expenses. So all of these things are things that employers care about. From an employer perspective, they actually see increase in health insurance costs for employees who are caregiving because they're having a lot of their own health issues that they often leave unaddressed, or mental health issues, that kind of thing. So health insurance costs tend to go up. Certainly lost productivity and workday interruptions, again, trying to make appointments or trying to help a family member, that sort of thing. And then increased absenteeism. I don't think that's a surprise, having to, if you're working in an office, having to run home because something's happened or a caregiver doesn't show up or that sort of thing. So over 60% of people who are caregivers have had at least one change in employment. Either they had to drop out of the workforce and come back, or they had to switch to part-time. And all of those things cost the employer money when they have to retrain, when they're trying to fill positions. So for all these reasons, my second takeaway is that employers care about family caregivers too. As I mentioned earlier, the bigger companies are the ones that can offer the most benefits. I think there are articles out there about Deloitte and Microsoft offering up to 4 weeks of benefits a year for people to be able to take time off to help in family caregiving. But also a lot of employers are offering navigation services. And when you look at surveys of employees who are dealing with a caregiving situation, the two things that they're most interested in is flexibility with their work schedule, and then help with trying to navigate the system and find care. So now we're on to my third takeaway, which is that I would say the federal government, and state government too, but I don't do that much work in state government, is increasingly paying attention, partly for the reasons I mentioned early on, which is they're starting to realize that all these gaps in care that are happening are costing the federal government a lot of money through Medicare and Medicaid. So even though, as Claire mentioned, Medicare doesn't pay for most of long-term care services, they are paying for them in the sense of all of these health complications that happen because of the gaps in care. Also, I think, just my opinion, but a lot of legislation comes about because of either personal experiences by lawmakers or anecdotal stories they hear. And I think more and more of us and of them are having these personal experiences or hearing about them from their neighbors, friends, and constituents. And so I think there's just more attention. So there is legislation that has been introduced for the past several years, but with a growing number of co-sponsors on the legislation, which is the Credit for Caring Act, which would actually pay family caregivers to provide the services to their family members. And then the second piece of legislation I wanted to mention, because I'm going to have it on another slide in a second, is the Comprehensive Care for Alzheimer's Act. So this legislation does a lot of things to address Alzheimer's care, but one piece of it is specifically related to caregiving. It provides coordinated care services, it provides training, which I mentioned earlier is so critically important, training to those family caregivers so they know what to do, and then also it helps them with navigation through the system. So we'll get to that in 1 second, but flipping over to the Health and Human Services and to the administration and what they're doing on family caregiving, there was an executive order which the president issued this summer, which talked about improving home-based care to veterans, and that has been already put into place. Also more mental health services for family caregivers, because as you can imagine, that's a tremendous toll on them caring for their loved one. And then also in that executive order, it required Department of Health and Human Services to put together a demonstration project on dementia care modeled after that legislation I just mentioned. The physician fee schedule, not to get too nerdy here, but the physician fee schedule has come out. It's a proposed rule right now. It hasn't been finalized. But remarkably, it has provisions in it that would actually pay for caregiver services. So it would pay providers if it's finalized, and I haven't heard of any reason that they wouldn't. I don't think there's any controversy around these particular proposals. It would pay caregivers to assess family situations and social needs, and help family caregivers with navigation services that could be provided by their office, or they could be referred to a community resource. And it also helps with the caregiver training again, which I keep mentioning because it's so important. And then it also has this integrated care model, again, for dementia. And I think there's so much attention with dementia because there's just an exploding population of people who need those services. And again, when you think about what's costing the federal government money, dementia is big coster. So back to that legislation I mentioned, and then the executive order, and then now we actually have this demonstration projects that's come out of Center for Medicare and Medicaid Services that was announced. It's modeled very much like that legislation that I mentioned, and it's voluntary, so providers don't have to participate, but it's modeled in such a way I can't imagine that there won't be a lot of interest, and it focuses on a lot of those components I mentioned before, whether it be training, quality of life, just general strain on individuals. And it's really about trying to help keep people in their homes. And it sounds like you all have talked about this a lot already, that overwhelmingly most people as they age want to stay in their home, and the cost for staying in the home is dramatically better. And in many cases, I don't want to say most, although I feel like I could, the outcomes are better for people who are in their home as opposed to in institutional care. So a lot of these changes that we're starting to see coming from the government is helping to transition so that care can happen in the home instead of being done in an institutional environment, which has been the model up until now. So we also saw coming out of the pandemic the telehealth waivers that allowed more care to be done virtually so that people didn't have to leave their home. And those were extended for 2 years, so they'll expire at the end of 2024. I think there's general consensus, both on the Hill and in the administration, that people think that should be extended or even made permanent. So that really helps with a lot of this care of not having to move people back and forth to the doctor's office or wherever else if they can get that care at home. And then a related piece of legislation that, again, I don't want to say there were a lot of benefits to the pandemic, but it was another outcome that has proven to be really effective, is this idea of hospital at home. So it's remarkable to me, but the people can receive acute care services through remote patient monitoring and other services that you would normally have to be hospitalized for. And for the patients who qualify for the program, their outcomes are much better if they stay in the home and receive those services than if they go somewhere else. And the family caregiver, again, plays into that because they're there to help and provide those services, and the models factor in the role that the family caregiver plays there. So that also expires at the end of 2024. I think there's a little bit more concern about whether that program needs to have some more boundaries put around it, but in general, there's support for that as well, and certainly for the understanding the role that the family caregiver takes in making that program successful. So that is it. As I said, my 3 takeaways: Healthcare community actually likes having family caregivers and wants to support them. Business community understands the burden on their employees as family caregivers and is looking for ways to help. And the federal government is starting to realize the benefits of supporting family caregivers over other models.
Thank you, Debbie. Claire, why don't you come up and join us? I really appreciate you highlighting the issue of outcomes from COVID-19 and how they have affected our understanding of or knowledge about long-term care. Specifically, when we're talking about this fellowship program and what we're trying to get across to the journalists is, as the numbers grow, as we have this larger aging population, COVID created a situation where people don't want to be in a facility. They don't want, or they're afraid that if they go, something worse will happen to them. So I think that's another kind of trick that we can have for our journalism toolkits. When you go back and start thinking about how do I want to pitch these stories to my editor, there's a whole wealth of stories that you could do around how COVID affected long-term care. Obviously, the ones that were first reported was the fact that people died in long-term care facilities. But I think now that we've somewhat emerged from the first round anyway, there's some analysis to be done. But let me open it up for questions. Does anyone have? Alex, we'll start us off here.
I had a question for you, Debbie. You talked about some of the reasons why healthcare providers, insurers would be interested in caregiving, and some of the really strong outcomes that are had in terms of shorter hospital stays, all things that can save them money, right? In your conversations with those executive leaders who are on the HLC council, have there been any conversations around incentives that they might provide for caregivers to be for family caregivers?
They've primarily been focused on the Family Caregiver Act, that would give federal money, and the other place where they have been focused is on the training piece. So I think, yes, there is interest in the training. When I think about I think you're probably asking about health plans mostly, whether health plans would pay caregivers. No, we haven't had that conversation specifically, and I'm just trying to think what the regulatory barriers might be to their being allowed to do that. There has been an effort underway that was successful in developing a career track for community health workers. I mean, that would be paid. But I think the concern is about making sure that if they're paying people that they have the correct training. And I think that's probably what the barrier would be, but I don't think it's insurmountable.
Oh, sorry. Andy Richards, NJ Advanced Media. I Googled the bill that you mentioned, the HR 2505, and it looks like it was just introduced in 2017. And I was wondering, in your experience, like, how long will that take?
Yeah, and it was actually introduced before that, but
Okay.
but under a different number. It just all. I mean, the problem is it costs money. So it's a matter of either I don't think I have to explain to all of you since we all went through the countdown on Saturday. In the current environment, it's all about finding an offset to pay for it for the most part. It's in previous Congresses, I actually thought it might get slipped in and not necessarily require an offset, and that's probably the best hope that it has. I'm not sure. I don't see. Well, it hasn't even been reintroduced this Congress yet. So, but there is. With that said, there's a lot of support for it. I think the better chance it has is getting rolled into something like the dementia care model, where that's a piece of it, but it's addressing the issue more broadly. Like the dementia care model, that legislation analysis of that shows that it actually would save money overall, and I think the caregivers being involved would save money overall, but when you just pull out the one piece, it looks like it costs.
So just one quick follow-up question. So how could advocacy help that? Is that something that people could call their legislators and say, hey, this is my understanding of this bill. can you work on getting it put together with the dementia bill? Like, is that
Yes,
something
I think that
viable?
would be the best thing to do, would put it into something else that's addressing care delivery more broadly. And yes, and I think advocacy would help. I mean, that bill had a lot of co-sponsors. It's just, it didn't have the oomph to get it over the line, and I think because of the cost.
Claire, you have been covering these kinds of stories for a while, and you gave us some really wonderful examples of, and told us a lot about the process. But many of the folks in this room have not had a long track record in this. And we've been talking over the past day about the need to pitch. How do we pitch it? How do we get an editor to think beyond just stories of decline or stories of the 89-year-old marathoner? So can you give some sort of broad advice to the journalists about what to keep in mind when you're pitching these stories?
Yeah, for me, the way I pitch stories and the way I report and the way I do things is I usually find an example, a compelling example, and then find the data and the reasons behind it. Like, why is this happening? What does it mean? Who cares? And why should we care? But that I am more drawn to those human stories. And in terms of finding those, I often do a lot of reporting, talking to experts and, just what they're seeing. And, they may lead me to something. A lot of it, too, is talking to family and friends and seeing what's going on in their lives, because again, we are all in different situations. And even if they're a person or their relative, or because I wouldn't do it on somebody that I knew, but what they're experiencing, everybody's experiencing, or a lot of people are. And so then I will kind of look around and start reporting and talking to people saying, have you heard this? Why is this happening? Can you explain this to me? And then just kind of broaden the net till I find an example. And I find that I have better luck getting a story through if I have a good story to tell about somebody in that relationship, because you want to make it relatable. I think, again, people have so many competing interests, and they don't. I mean, they'll scroll through, and whether they read something or not, they have to feel like it means something to them, or it touches them, or they personally will learn something.
Debbie, I'm wondering how you deal with what I'm sure is a somewhat common refrain that big business and CEOs can't possibly care about the common man or woman who's struggling. And so you make a very compelling case about why the council exists and why they do. But how do you, particularly in a room full of cynical journalists, how do you sort of further get them to believe that CEOs care about this?
Yeah, well, I mean, I think that they do care, but they also, particularly the ones that are publicly traded, I mean, they have an obligation to their shareholders. And so I don't really try to address it from the standpoint of being altruistic. I try to talk about it from the standpoint of the bottom line. And there is a bottom line reason that they should care. One is, as I said, they cannot solve this problem themselves through hiring people. There are not enough people in this country to work, in healthcare to solve this problem. And so they really have to rely on family caregivers. And so it then turns out to be, and as I said, most of our companies are trying to move into this more value-based world, and they need. The key to that working is to avoid these problems that happen in transitions in care. They need family caregivers. And so it becomes a win-win because they have a reason to support family caregivers. And so I really don't try to convince people that they're altruistic.
As we wind down, we are actually near the end of our time, but I'd like to ask Claire, because you've had a chance to sit in on most of the sessions today, have you heard something in these conversations that sparked a story idea for you?
Yeah, but I'm not telling you. No.
Wow. Okay.
You know, one thing that you said about your husband, this sort of informal thing that's happening, I think that probably happens a lot. And I was thinking that's probably a great story, profiling small businesses or business owners who are quietly doing this to make it work. So I think, you know, that's a good story. I also think localizing, I mean, there's so many variations state by state with the Medicaid, especially if you want to be if you're a family member who wants to get paid for the services. It really does depend upon the state, and there's a lot of inequities. You know, we didn't even touch on people who are disabled and, you know, that whole care world and, you know, how that is funded. And, you know, in some states, those things are funded by county levies. And so you could live in one county where the voters pass it and another county where they don't. And so just across town, you know, you could get services. At any rate, the inequities, I think inequities are important. I think it's really important to bring the what's happening broadly down to where people live and what they care about, and you know, so that would be my thing. I think the small businesses is great. I think the inequities and the state differences, it's sometimes really hard to figure it all out because it's complex and. But I think that's a real service. I think it's because people are all struggling. They're all navigating this mess. And so if you can guide people and explain things, I think that's great. And if you have a person who's dealing with that to share their own struggles, that I think people relate to it. Okay, I'm done.
Debbie, take us home. What's a story you'd like to see?
Well, I didn't talk about this because I couldn't find enough information about it, but the American Rescue Plan Act gave just about almost $13 billion to states to implement home and community-based service programs. The Biden administration is allowing states now, they just announced a couple months ago, they're going to let them keep that money and find ways to use it through, I think it's March of 2025. But some states have, again, out of the pandemic, found ways to use that money to provide family caregiver training or navigation services. Others aren't doing anything. Some have programs that they started, and I can't tell if they're continuing. I would be really interested in a story that really looked at what happened with that money and what the sustaining opportunities are to keep that going.
Excellent. Well, this has been a very solid discussion about supports for families and services. And so let's take this opportunity to thank Debbie Witchey and Clare Ansberry for joining us today.
Thanks, Claire.
Thank you so much.
Thank you.